It's time to talk about healthcare services. For those residing in Lagos and you're not aware of the state government's health insurance scheme called Ilera Eco, let's just say you're missing out on affordable and quality services. The General Manager of the Lagos State Health Management Agency, Dr. Emanuela Zamba, says the healthcare package is for everyone, irrespective of economic status, and spread across public and private hospitals in Lagos.
Getting access to quality healthcare services has become a lot easier in Lagos with the help of the State Health Management Agency, LASHMA, which was established in 2015. The State Health Agency kicked off effectively in 2020 and is driving the course of universal health coverage in Lagos through the Ilera Eco healthcare package for residents. The General Manager of LASHMA explains the progress made to date.
The agency, with the approval of Mr. Governor, of course, established what we call the Eco Telemed, which is the state's telemedicine platform. And that platform was mandated to provide virtual healthcare to Lagos residents free of charge at the time, so that you would not need to walk into a hospital once you had a complaint, except it was an emergency. And we had doctors speaking all the languages 24 hours. They would attend to you, they would give you a prescription, and they would refer you maybe to a lab or pharmacy to get your drugs. So we reduced essentially the people that were going into the hospitals and tried to at least do our own bits with regards to reducing the spread of COVID. That telemedicine platform now has grown to become the backbone of the COVID state response, and it is responsible for tracking of passengers of interest. That's people coming into Lagos on a daily basis. They are tracked using that telemedicine platform. Those that are now vaccinated, of course, we don't interfere, but those that are partially or not vaccinated, we do follow-up phone calls to ensure that they do their tests. And if you are positive, you are now put onto the home-based care program and monitored. So if you escalate, we report that to the state response system and you are put into facility. However, if it's uneventful, after 14 days you are discharged from the home-based care, and that's the end of that. We are also administering what we call the COVID helpline. So you can call in at any time if you suspect somebody in your neighborhood has COVID, or you see some new family that has come in and you feel, somebody there looks like they're ill, or etc. You can call the COVID helpline and give us that information, and that is escalated and will be investigated. As I said, we are still working because, as we know, we've had a rise in COVID now, and that is something that has become entrenched as part of our surveillance system for COVID response. Now, moving along from the EcoTelemed, in July of 2020, we started providing access to care for all the public servants in Lagos State. That has continued till date. And in fact, based on our feedback and engagement with the public servants, we were able to now start providing the telemedicine services free of charge as a complementary service to the public servants.
Over 200 public and private health facilities are registered under Ilera Eco. She reels out the various health plans suitable for a whole family as well as individuals.
We started off, I think, with about 40 facilities, but we now have about 250 of them, and they comprise both public and private facilities. I think the private facilities make up about 57 or 60% of that number, and they are spread across all the local governments, and we continue to get providers who are joining us as we speak. So you can come on board with the Ilera Eco Pay Small Small with as little as 1,000 naira per month for an individual and 3,500 for a family of 6. Our standard plan is 8,500 for an individual per year. As I mentioned, this is per year, and 40,000 for a family of 6 per year. And that is father, mother, and 4 children under the age of 23. It used to be 18, but with the feedback that we got from the public, and we all know we all have children, children of 20, 21 are still at home being fed by parents and are still dependent, so we had to increase the level of coverage from 18 years now to 23. So if your children are under 23, you can bring them in on your family plan. We've also expanded our bouquet of services, also based on feedback with the public. We have what we call our seniors plan now, whereby residents that are over 60 can come on board onto the scheme. And what that offers you is that not only do you have the services under the standard plan, but you're able to do like a yearly screening test that would help you to ascertain if you have cancers, etc., which we know is very important as we get older. So we have that as an individual plan for 34,000, and as a couple, which is daddy and mommy, that comes to 65,000. So we actually give a discount of 3,000 naira. We've also come up with what we call our Ilera Eco Standard Plus, and that provides an additional bouquet of services over and above the standard. And that was also based on feedback from the general public, including even public servants. Now, what if we want something a little bit more? So that is also available for people to come on board, and that is at a cost of 12,000 naira for an individual per year and 75,000 naira for a family of 6.
For those interested in the health scheme, the ICT officer shows the registration process.
To enroll, you just click here. To take you to this page, on this page, you are going to look at, you will select the scheme in which you want to register for. So now, we have so many of them. I want to register for a standard plan, which is our first plan. Then you select whether it's an individual or for a family. So I'm selecting an individual. Then it will tell me how much I'm going to pay, which is 8,500. So the next is to click on next. Now, you will now fill in your biodata here. So anyone with red are compulsory field for you to fill. So the first one is your title. I'm a Mr. Because the live data, so you need to select your surname. For example, I want to select Oladejo, and my first name is Sefiu, and then my middle name is Olatunbosun. So then you select your gender, either you are a male or a female. In this instance, I'm a male. You select your date of birth. So it can give you a calendar, and you'll be scrolling back to get to the year you are born. So then you put in your phone number. That phone number is the correspondence number that you'll be getting SMS. So my phone number is 8056274068. Then optionally, you can put your email address, otherwise you leave it blank. My state of residence. For you to be entitled to this scheme, your state of residence must be Lagos. So I'm selecting Lagos. Then you also select your LGA. That's the local government you stay in Lagos. Let's say I'm in Ikorodu. And then you put in your words. Ikorodu General Hospital. So this is Ikorodu General Hospital. Then my physical address. That's the address where you stay in Ikorodu. I'm saying 12. Ile Street. And then whoever market this product for me, that's by the referral person. So I'm selecting, let me just select somebody, and then I add beneficiary. The moment you add beneficiary, the enrollee will receive SMS that he has registered for the scheme, and his policy ID will be sent to use our phone number. It's completed. So it has given me a policy ID. That is what I'm now going to use to make payment.
A consolidated revenue fund of 750 million naira is also set aside for the vulnerable groups.
We continue to strive to try and cover the generality of the public. We started with about 10,000 when I got here in 2020, and that number has now risen to 623,000 lives on the scheme. So the law sets aside 1% of the consolidated revenue fund, called the equity fund, for us to be able to pay for those that cannot pay for themselves. That fund in itself, 1%, is not enough to cover everybody, but we have recently established an innovative financing mechanism which we call the Eco-Social Health Alliance. We're hoping to launch that formally very soon, which is a mechanism whereby we'll be able to pool resources to complement what government is doing with respect to helping to pay for the lives of those that cannot pay for themselves. So Mr. Governor thus far has graciously approved 750 million for the vulnerables. We have been able to enroll some vulnerables. We just got a tranche of 300 million out of that 750 million. We just got custody of those funds, and we'll be rolling out in the next few months to enroll a lot more people in Lagos State onto this scheme.
Over 600,000 residents are registered under Ilera Eko Health Scheme. The state government is calling on other individuals to take advantage of the initiative and enjoy affordable and quality healthcare services in Lagos.